How does functional medicine approach a case differently than conventional medicine? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Today I want to use a real live case to show you the difference between how conventional medicine looks at a case with a bunch of findings and how functional medicine looks at a case with a bunch of findings. And this case has findings that are seemingly not related, and so in a conventional model it would be treated or approached from a totally different aspect than a functional medicine model. So let's dive in. Let's list what's going on first. So this person has decreased vitamin D levels. This person has increased insulin resistance levels, or has insulin resistance, period. This person has systemic inflammation. This person has low iron levels. And this person has a Th2 bias to their immune system. So if you're out there saying, what is a Th2 bias to the immune system, then check out my video on YouTube. If you search in YouTube Bartemus and how does the immune system work, I'll walk you right through it and tell you all about the Th2 immune response. So in a conventional model, this person would be approached as having an immune dysfunction, but in real life they wouldn't even be considered that, because in the conventional model they don't know the nuance of the immune system. So they would just say, hey, you have this finding on a CBC and that's about it. So immunology is a deep rabbit hole that typically the mainstream medical doctors don't go more than a toenail into. So in order to really help someone with immune dysfunction, we have to go much deeper, and that's a fundamental difference between a mainstream medical approach to this and a functional medicine approach. But not all functional medicine doctors are deep on immunology either. So the Th2 shift of the immune system is a big issue. A decrease in iron status or insufficient iron levels, that's a big deal. What could be causing that? Well, maybe intestinal permeability or leaky gut, maybe malabsorption, maybe the immune shift is leading to decreased serum iron because the immune dysfunction that this immune bias is dealing with is causing sequestration of the iron, or pulling the iron out of the blood so that maybe a pathogen can't get it. Systemic inflammation, well, that can be driven by immune dysfunction and all kinds of other things. Decreased vitamin D levels, that could be malabsorption, that could be no exposure to the sun, or that could be high inflammatory levels, so you're metabolizing through your D faster. And high insulin resistance, well, that could clearly be due to blood sugar abnormalities, or it could be due to inflammation, which is decreasing the receptor sensitivity to all hormones. So what do we see in this person? In this person we see these interconnections. And so we see that the Th2 bias is leading to iron sequestration, so that the iron is being pulled out of the serum so pathogens can't use it to hurt the human. We see immune imbalances driving chronic inflammation. That chronic inflammation is making this person metabolize through the vitamin D very fast and lowering their levels faster than they're replacing it. And the high levels of systemic inflammation are driving insulin resistance or decreasing cell sensitivity to insulin, leading to blood sugar issues. So this is an interconnected group of symptoms that the mainstream medical model would probably address as their own unique things, but in functional medicine we would say the nexus or main point that needs to be addressed in this person is right here in the immune system. Because if we can balance this immune system, that gets rid of the systemic inflammation. We no longer have to hide iron from pathogens. Without the inflammation, D levels can rise to where we want them to be. And without the inflammation, we're losing, in this case, what's driving the receptor insensitivity to the hormone. So I'm Dr. John Bartemus, and functional medicine approaches you as a whole individual and looks at all the contributing factors of your case versus just a list of symptoms.